This is a production of Cornell University.
Good afternoon. I want to welcome you to the George C. Popinsick lecture. And today's lecture is part of the George C. Popinsick Visiting Professorship in Global Animal Health. This program is supported by an endowment in recognition to Dr. Popinsick, who was our fifth dean here at the College of Veterinary Medicine from 1959 to 1974, in recognition to his interest and contributions to international animal health. And we're delighted that Dr. Popinsick is here with us, and I want all of us to join me in recognizing him. Dr. Popinsick. This lecture is also part of the Zoonotic Disease Symposium that our students have organized, and many of you have come here from long distances, so welcome to Ithaca, welcome to Cornell, and we hope that you will enjoy this symposium that will take place Saturday and Sunday. Our speaker today is Dr. Lonnie King. Lonnie King is the director of the National Center for Zoonotic, Vector-Borne and Enteric Diseases at the Centers for Disease Control and Prevention in Atlanta, Georgia. This center, just to have you have an idea of the scope of its activities, is responsible for surveillance, diagnostics, disease investigation, epidemiology, research, public education, policy development, and disease prevention and control programs. These activities include most of the CDC work on select and bioterrorist agents, neglected tropical diseases, and emerging zoonoses. So he has a pretty large portfolio of activities. And he tells me that his BlackBerry has been ringing with more and more news about the Salmonella peanut butter contamination in the last few days. Before being director of this center, Dr. King was the first chief of the CDC's Office of Strategy and Innovation. Prior to his work at the CDC, Dr. King was the dean of the College of Veterinary Medicine at Michigan State University. He was dean there for 10 years, from 1996 to 2006. And prior to being dean in the Michigan State, he had a distinguished career that spanned almost 2 decades at the U.S. Department of Agriculture. He retired as the administrator of the Animal and Plant Health Inspection Service, APHIS, who, for some of you that are not familiar with APHIS, is the agency entrusted with the health and care of animal and plants and the improvement of agricultural productivity and competitiveness in support of the national economy and public health. He was also the U.S. Chief Veterinary Officer and the U.S. Delegate to the World Organization for Animal Health. And during that time, he was my first boss when I started at USDA. Before joining the USDA, Dr. King was in veterinary practice, private practice, for about 7 years in Ohio and in Georgia. He's a native of Worcester, Ohio, and received his Bachelor of Science and Doctor of Veterinary Medicine from Ohio State University in 1966 and 1970, respectively. The Ohio State University, I'm sorry. He earned his Master's of Science degree in Epidemiology from the University of Minnesota in 1980. And he also has a master's degree in public administration from the American University in Washington, D.C. from 1991. He is a board-certified member of the American College of Veterinary Preventive Medicine, and he's also an elected member of the Institute of Medicine, one of the institutes of the National Academies. He is a member of the Committee of Microbial Threats and to Health in the Institute of Medicine, and also is a member of the FDA Board of Scientific Advisors, and past president of the American Veterinary Epidemiological Society. Dr. King serves as an advisory or adjunct professorship roles in 6 universities. He is also the chair of the National One Medicine Task Force of the American Veterinary Medical Association, and he is the current point of contact for the One Health activity at CDC, and a lot of the things that he's going to be speaking to us are related to those activities. So, please join me in welcoming Dr. King for his lecture tonight. Thank you very much.
Thank you very much, Dr. Torres. Is this working back there? So it's a pleasure for me to be here, even from warm Atlanta. When Dr. Torres asked me to consider coming up to Cornell to deliver this lecture, and I found out that it was associated with Dr. Popinsick, I said, absolutely. He then told me when it was and how it. So it's a special privilege for me to be back here. And I want to acknowledge, and I will at a final slide here when we're done, what a tremendous mentor, gentleman, and professional that Dr. Papansik is. And his leadership has been extraordinary. And I've been fortunate to count him as a friend and a mentor and a colleague. And I appreciate everything he's done. And it certainly was influential in my life. So we'll talk more about that. So today I want to talk to you about One Health. What are the challenges that we face? What are the challenges you're going to face here at Cornell? Why are these challenges occurring today? What does the future hold for us? And then talk about some foresight analysis. What should we expect? What are the insights that we've learned? How are we going to actually translate those to special actions? What are the opportunities available to us? What we should do? And why One Health is an appropriate topic today, and the challenges and opportunity, I think, for this university. So that's a lot to cover. We're going to do it pretty quickly. So what does the world of global health look like today? Well, first of all, in the United States, every day, so since you ate dinner last night till this time, in the last 24 hours, 560 children were hospitalized with pneumonia. 583 adults were newly diagnosed with breast cancer. 850 children have harmful lead exposures that have been identified. 876 seniors will suffer hip fracture in the last 24 hours. 888 people are hospitalized for foodborne illnesses. We're going to actually make that higher since peanut butter and the problems that we've had. 1,294 teens have attempted suicide and require medical attention in the last 24 hours. Also, within 24 hours, 1,910 children are admitted to emergency department with acute asthma. 3,800 teens start using tobacco at a time that we know what the impact is. 4,100 newly diagnosed people with diagnosis. 12,000 workers suffer work-related injuries. 4.5 million seniors will continue to live with Alzheimer's. 13 million children are overweight and counting. 42 million Americans get their drinking water from potentially unsafe sources. So why is public health important to us on a global event? Well, in the last 24 hours, 1,244 children have died of measles, a vaccine-preventable disease. 1,670 children die of rotavirus, a vaccine-preventable disease. 3,562 people die of malaria every day. 5,479 people die of TB, and 8,200 people more die of HIV/AIDS. So, and on the chronic disease and accident side, think about 3,200 people dying of just of accidents. So this is the importance today. And in some countries in sub-Saharan Africa, you can imagine that 50% of the children don't make it to age 5. So why is this important to our lives? Why is One Health important? Because that really is unacceptable. So my bent is especially a bias toward infectious diseases. So there's a lot happening in chronic disease, a lot happening in environmental health, and other problems in health, but I'm going to take you through kind of my lens of infectious disease. So what is happening in the world today where all these new diseases are emerging? Well, we have genetic and biological factors that are taking place, and this remarkable adaptation of microbes that have been happening for thousands and millions of years, and now they're accelerated because of the opportunities that they have. Climate and weather change, economic development, human changes of the environment and different ecosystems, human demographics, and the remarkable movement of people, animals, and products worldwide. So the Institute of Medicine describes this as the perfect microbial storm, kind of feeding off of the book about the perfect storm. But these are not meteorological events, they're almost daily occurrences, where these factors have created a storm, if you will, that in the middle of that storm and at the convergence of human and animal health, we are now seeing record numbers and unprecedented numbers of emerging infectious diseases that we've never seen before. So why would this be important to CDC? Why would CDC start a center with 1,000 people to start looking at zoonoses and infectious disease behavior and work at the interface of human and animal health? Well, this is the evidence. So these are significant global epidemics over the last 15 years. So your quiz is, how many of these are zoonotic, meaning how many are transferred from animals to human? So for a free cup of coffee, the answer is all of them. And we didn't think that perhaps that was the case with Norwalk viruses, but that absolutely is the case. And we know that we're actually transmitting Norwalk viruses back to animals as well. So this is the evidence. This is what's happening in public health. And this is the convergence of human and animal health and why this is important. This chart comes from Kate Jones out of an article from Nature. And if you just take a quick look, she's actually looked at emerging infectious pathogens and diseases over the decades. And if you look here from 1940 to 2000, and all these are the same charts, you can see that this is the decade of HIV/AIDS. So we have a special increase in emerging infectious diseases. But every decade, these emerging infectious diseases are going up. The black is our zoonotic infections. The zoonotic infections are all those except the black. These are taking a look at the transmission in vector-borne diseases, which have really increased over the last decade, looking at drug resistance as emerging infectious diseases. And there's nothing on the horizon that would suggest that this increase will do anything but continue. So it will continue unabated. So in the world of animal health and veterinary medicine, this is not new news for us, right? We believe that perhaps 80% of our microbes that we deal with are multihost pathogens. So the understanding when I was a practitioner out on a farm that we thought about population medicine, population health, and the ability for organisms to transfer among species. We now know that perhaps 60% of the human pathogens are multihost pathogens. And over the last few decades, that 75% of all new emerging infectious diseases are indeed zoonotic. So it is time to take notice. So as we take a look at this convergence, this will tell you how old I am as a kid. Remember the thing's called a kaleidoscope, right? So you had you turned the parts of the kaleidoscope, and it gave you new dynamics every day that you look at it because the glass would change. So every time you turn it, you get a new picture. And that's kind of what's happening in the convergence of human and animal health. We kind of get up in the morning, and we find new possibilities and new dynamics we didn't see. So I think it's the kaleidoscope, if you will. So let's take a look through kind of each of these dimensions and see what's happening. So let's look at what's happening in public health and human health. So the trends in population growth are pretty amazing. So this is U.S. Bureau of Census going from 1950 and projected to the year 2015. The red bars are the growth in developing countries. The blue is the growth in population, human population, in developed countries. So you can see that over 90% of the world's growth today is taking place in developing countries. The countries that we really worry about having the infrastructure in place in human health and animal health and the ability to engage new emerging infectious diseases where they're most likely to occur. This is a chart to look at world population growth from 1950 throughout this entire century. So just take a look as we look at 11.5 billion people on the face of the earth and where that population growth is going to take place. Primarily in Asia, in Africa, and Latin America. Okay? These are the countries that we need to do more work in, be better prepared as we move into the future. And the other thing that's happening is this amazing shift. So we are now involved in the most significant movement of people in the history of humankind. There are more people moving around the world in different sites than any time in human history. And what is happening is that we now have more people living in urban settings than in rural settings. And one of the things happening, especially in urban settings in poor and middle class, is this, what we call shift to megacities or peri-urban sites. And it's the new Wild West. So of the 20 largest major metro areas in the world, every one of them have a significant slum area. And as part of that is this peri-urban setting, if you will. And it is creating remarkable new niches for vectors, for parasites, for diseases that be transmitted between animals and people, environmental degradation, if you will. And this is not an uncommon sight at all. And it literally becomes some of the critical hotspots as we're looking for emerging infectious diseases as we move ahead. This is just a chart that one of my colleagues loaned me, and it's an example of life tracks. And it's look at travel over 4 male generations through the same family. So this is the great-grandfather in a part of the UK. And so his lifetime was spent within 10 kilometers of his home. Now his son, or the grandfather, went a little bit further, almost 100 kilometers. And his son, or the father, now has gone internationally. And the son, or the contemporary person of this consecutive generations, now travels worldwide. So it gives you an idea of how much we're changing, how much we're moving, and how remarkable that is. So there's nowhere in the world from which we're remote, no one from whom we're disconnected. It is part of a single world. And that's why that these diseases are transmitted so rapidly, and we're concerned then about the zoonotic nature of these. So kind of what else is happening in the demographics that would favor emerging infectious diseases? So this is a chart looking at millions of people that are foreign-born people persons coming to the United States. And these are the date line for the century. So we know that at this time was a remarkable immigration of people into the United States and part of labor. It's part of the richness and fabric of our society. And it continues, and should continue. But you can see now the number of people coming from out of the United States into the United States. And this is happening worldwide. It's not just happening in the United States. And these are the number of new tuberculosis cases in the United States from 1993 to 2005. These are the number of new cases. This is by year, right? The greenish color are U.S. born, so 18,000 cases. More than half of them are U.S. born. And over a period of just a few years, you can see that number of new TB cases really have a higher percentage now in foreign-born people living in the United States. And look at what happens also when we take a look at tuberculosis that is resistant to antimicrobials. So there's nothing wrong with the idea of immigration. It's part of the richness of our society. But it also has changed the face of infectious disease in that how we make plans and policy changes to counteract this. So in demographics, tremendous migration and translocation of people unparalleled in the history of time. Big peri-urban settings starting up that become hotspots. Immunocompromised populations. I happen to be very interested in that because I'm on the front edge of the baby boomers. And in public health, it's described as the pig and the python, as 90 million people move through. And what comes out of the other end may actually be a whole group of people that are immunocompromised to a certain extent that actually may have to undergo new childhood vaccines to repeat their vaccination. And I will tell you that foodborne and waterborne illnesses are really going to be on the increase. Recreation practices, we go on ecotours, go in bat caves in Uganda and all over places and come back with diseases like Marburg. So we had our first human case of Marburg in a person in Colorado that was misdiagnosed and came back with Marburg. Shifts in food, and we're going to talk about that in just a second, and health disparities. One of the real critical problems worldwide is that poverty is a part of what causes more diseases, and it is the accelerator that lives in poverty that will actually increase our problems in public health, not only worldwide, but in this country. So what's happening in the world of animal health? We've certainly got some veterinary students here and faculty, and so how do you feed 6.5 billion people that have a new appetite for proteins from animal sources? Well, one thing is we can concentrate animal feeding operations. This isn't bad or good. It is reality. And we also worry about these populations themselves. as vulnerable populations, where infectious diseases can and do emerge from these populations as well, right? And continuous impact on food safety and our environment. These are international tourist arrivals, right? So these are people moving through the system, and just that there's going to be 1.6 billion people moving around the world every year, with, in part, animals. So there was a study done by the Food and Agriculture Organization called Livestock 2020. And it's pretty much on schedule, although this last financial problem may take it off a little bit. But they are estimating that there may be between 1 and 2 billion people on the face of the earth that will shift from a form of poverty to a form of middle class. And when they do that, and they actually gain funds and are creating wealth, one of the first things they do are westernizing their diets, for good and for bad. Right? And when they westernize their diets, one of the things that they're really looking at then is this major increase in proteins from animal sources is one of the first things that happen. So our concern is about the sustainability, increases in zoonoses. So last year, 21 billion food animals were produced to help feed the 6.5 billion people, with trillions of tons of products being distributed worldwide. And this study, which is right on, would say by the year 2020, there will be a 50% increase in the demand for protein from animal sources. So that means we're going to add 10 billion more into the system as we increase by hundreds of millions of people. And the great mixing bowl and convergence continues and accelerates. So this is pretty good news for veterinary medicine. Pretty good news for agribusinesses. So this is the world meat consumption from 1983 to 20 and projected to 2020. This is million metric tons, right? And as we look today and into the future, this is the growth in meat consumption in the developing world, the red line. So look where the protein sources are going to be, right? A 50% increase. And this is what we do in the developed countries. Projected species production increases. So just look at this line and how quickly it goes up for pork, for poultry, for beef, and this is lamb and mutton. Okay? So this is adding 10 billion more animals, food animals. Doesn't count fish or aquaculture. Right? And how are we going to handle this with sustainability, with environmental issues, with new foodborne disease problems? So this is a look of Southeast Asia and poultry populations, complement of FAO and WHO. So you can see the poultry population densities, if you will. And then if we take a look at the human population itself, and you do an overlay, right, it actually then is a very nice fit where animals and people are converging together. This is a nasty slide, sorry, but just look at it this way. This is the center of Bangkok, Thailand. This point right here, right? This axis is human and animal density. So the more it goes up, the more densely the population is. And this is just looking at kilometers from the center of Bangkok. And so what it shows is what's happening is that this line is human population growth. So people are moving from rural areas into the center of cities. And look at this. This happens to be the movement of poultry toward the middle of a city. This is the movement of hog populations to the middle of that city. And this is the movement of maize and corn and soybeans that are pushing toward where the animals are to save money, so on distribution of foods. So what does the peri-urban center look like? It looks like this. This happens to be a shot that I took in Kenya. Okay. A new form of agriculture. There's millions of people moving in and out of the peri-urban settings, right? And nobody knows how many people are in these settings, but huge environmental problems, risk factors of diseases are going sky high. So what happens then when you try to increase populations of animals in areas of the world that don't have good infrastructures. So you could wake up one morning, unfortunately, and see this. So for my days, it was hog cholera or African swine fever, right? But it wasn't. And the people taking care of these animals also started to die. And the people that slaughtered them also started to die. And what we found out, and this was Nipah, Malaysia, that we had a brand new virus that crossed species lines. And this cute little critter is a fruit bat, genus Serotypes. It's actually about 4.5-foot wingspan. It's big and cute. It runs in large flocks. And when you put radio collars on them, they go about 150 kilometers every 10 days with an insatiable appetite looking for fruit. So they're moving all the time. What we found out was they're also asymptomatic carriers of Nipah virus. Right? And so when you started to put hog productions out in new ecosystems where the mango groves were, where the bats were feeding, and the saliva from the mangoes into the hog pen transmitted disease, the next transboundary infection is into humans, and we're off and running. The interesting thing about Nipah, if you're really into these things, is that the last outbreaks were 3 major foodborne outbreaks, right, in Bangladesh. And they're foodborne outbreaks now because they actually catch the syrup from date palm trees in big pots. And it's really nice for the bats that they don't even need to eat the fruit. They just sit on the pots and uptake this material. They happen to defecate in the pots, and we're off and running with another outbreak. So you could see how that changes. So we're in this remarkable era of trade. So the economic engine today is $12 trillion. It's probably a little less than that as of 3 months ago. But that's the economic engine we're dealing with. And a lot of that happens to do with agriculture and agricultural products. And people moving around the world in ways that we've not seen before. And I think that the critical part of this is that trade agreements are outpacing health agreements. The World Trade Organization, interesting enough, does not have a health committee. This is about making the deal. It's about creating wealth. It's about moving internationally in this remarkable global phenomenon, right? And these are some of the consequences in emerging infectious diseases. So if you're a sailor, right, not a kayaker in this lake, but a sailor, what would you do? This happens to be a look at one point in time along the oceans with 40,000 vessels, right, moving products worldwide. In the United States, we have 303 ports of entry, right, and we inspect less than 1% of all of this that comes in. So why are we worried about vectors coming in and new infectious disease coming in? Well, it becomes kind of evident. So it's the world of global animals and global products. And if you're really sharp, take a real close look at this pattern on this dairy cow. So this is the world of international global health, a remarkable global food system that we've not seen before. It's creating wealth, great opportunities, and also real challenges in human and animal health. So in the world of microbiology, this is the greatest time in history, right? This is the Club Med of microbiology, the happiest that they've ever been. They can move around the world faster than the incubation period of any of these microbes. They can cross species lines because they have more opportunity, right? They become resistant to microbial agents, right? And they're way ahead of our preparation to catch up with them. And the perfect microbial storm is that the acceleration is going faster. So why is it important for veterinary medicine and public health and agriculture and the assets and the intellect you have on this campus to come together to understand this? Because it's created whole new challenges that we've not seen before and amazingly complex problems. This is what we don't want to wake up to, folks. This is taken out of the UK, where they're burning livestock. This is indelibly put into your mind when you see it. It's incredible. And what we find in these situations is this incredible economic impact on diseases. We learned that in SARS, right? 8,000 illnesses, 800 deaths, and $60 to $80 billion of economic devastation. So this is a global phenomenon. And look at this merging giant back here, which is H5N1. That's going to be measured in reductions percentage-wise of global domestic products worldwide. Bigger than the bailout. So it's created this other world of diasporas. So I'm really into diasporas now. That's one of my new things. Diasporas are actually new populations that are created as people and microbes move. Okay? And it's really a new world. And so there's actually a whole new science on movement ecology. It's an emerging science on movement ecology. Very important to understanding these disease situations, landscape design, and all of this. Migration and immigration, we talked about that. Travel and trade, $12 trillion of economic wealth being created. Transboundary diseases, a global food system that we've never seen before. And the world of the microbiome, which is, there are more cells in our skin and in our gut than we have human cells. And it is that mix, if you will, of microbiome when you go overseas and come back and for animals and people, with a whole new population of microbes. And this is what we worry about diseases like Clostridium difficile in terms of changing of this microbiome. So this is the boat, the Grand Princess, just to give you some idea about the size when you put them next to the capital of the United States, right? These are moving diasporas. There are 5,000 to 6,000 people all moving together, having a great time until they get norovirus and have gastroenteritis with 2,000 of your close friends at sea for 4 days. So, but it is a way of just thinking about how quickly and how things actually move. So we have vectors and mosquitoes and ticks and fleas, but this is the super vector, right? A loaded plane that gets around the world, I say, faster than the incubation period for any of these diseases. So if I can get this to work. This is a 24-hour period of all the largest planes in the world that are flying and are condensed down to 1 minute in time. So I want you to look and see how quickly things move. Right? So, look at the movement in Europe. It's probably nighttime here in the United States. You can tell that this is summertime in the northern hemisphere because of the sunlight. And look at the movement over here in Southeast Asia and China and India. And now it's starting to change. We're waking up on our East Coast. All right. Planes are starting to move. We're waking up toward the West Coast. People now starting across the Atlantic, going into South America. Look at the traffic in Africa. Right? So this is one 24-hour period looking at transponders in large aircraft that are being traced by satellite. And it gives you some idea of how fast things move. Why do we wake up and find viruses in this country or in other countries? Well, this is why. So I think it's a good way to kind of take a look at that. So since peanut butter is on my mind, we have to remember that there's an estimated, and this is a pretty good estimate, although we're coming up with a new one, of 76 million illnesses, foodborne illnesses in the United States every year. Not usually a good thing to talk about at dinner time, but it's 1 out of every 4 of you are going to have at least one foodborne outbreak each year. Okay? And these are hospitalizations and deaths that go along with that. And since you're here now and not eating, you may stop on the way home and get one of those, right? So where does that produced? 6 million of those produced a day, 6 million a day in Salinas Valley, California. Right? The salad bowl of the world. A remarkable agricultural phenomenon, right? But small problems can blow up into big issues. So does anybody remember E. coli and spinach? Does anybody keep eating spinach? No. So when we took a really hard look at that, right? So let's take a look at this outbreak that happened in California, in Salinas Valley. And if you take a look at E. coli, and you take a look at View just through public health, so we now have our 3 different views. So let's look at public health. And at CDC, we love to do morbidity and mortality reports, outbreak investigation, we count cases, we look at hemolytic uremic syndrome, cases. And what do we do for intervention? We kind of wait for the next outbreak. So on that outbreak, because we have pulse field gel electrophoresis capability in every state, and we can do DNA fingerprinting and compare multi-state outbreaks, right? We figured out that, wow, there are a lot of states that are involved in this outbreak. And when we viewed that through animal health lens and looked at the animals involved, the very same E. coli organism with that DNA match in people and in spinach was the same match from wild hogs running through the spinach field. They don't like spinach, but they like vineyards. They run back and forth. And from the animals on the ridge above the valley, the cattle. Right? So, now we can understand more. But when we sent hydrologists out and looked at this through the lens of ecology and engineering and irrigation systems, what did we find? Well, the hydrologist said, well, this is pretty easy. You had 4 months of drought, you had a big rainstorm, all this manure washed down into the fields, and because you have such a pull in the irrigation system that the surface water and groundwater are now coming together, and when they took samples from the water in the irrigation, 40% were positive for E. coli 0157H7. So investigation was successful only when this information was integrated. You have to put it together. And so where do you go for intervention? Well, you don't go to the human hospital and keep cases. You have to do what we call moving upstream, the new paradigm for public health, changing from just surveillance and case reporting to moving upstream to looking at predictive analysis and prevention of outbreaks. The prevention strategy here may very well be how we produce animals and vegetables in the same area, or shouldn't. Or what are we going to do with irrigation systems that have been contaminated by a microbe from a ruminant that lives through adaptation inside the spinach plant for 20 days? And you're going to wash it all you want. It's the remarkable phenomenon of what's happening today. So when I was in private practice in veterinary school, unfortunately Dr. Torres didn't tell you when, I treated cats and dogs and horses, and so today you have a whole new specialty, right? And it's these exotic animals, and they're pretty remarkable. So annual global trade in exotic animals, according to the Wildlife Conservation Society, every year, 4 million birds, 640,000 reptiles. Look at the primates. And the illegal trade of exotic animals is only second to that of drugs. Transboundary diseases, moving around the world, and the ability then to change. So where else did we see this? Southern China, a live animal market called a wet market that's 3 times as big as this room. And you've got birds and reptiles and mammals and all kinds of animals all together with people moving in and out, slaughtering them with blood right on the site so people can have fresh food, right? And then all of a sudden we have a crossover. Right? And it's SARS. And SARS started as a zoonosis, for sure. It then transferred over. And we learned these lessons. We have to have integrated surveillance systems, prompt epidemiologic investigations, lab capabilities today that we don't have in many areas of the world. It's a huge disruption of not just public health. It's a huge disruption of an entire economic system. There are global implications of local problems that start in a wet bird market that go to a hotel with a super spreader and within a few days are in 30 countries. So those are the lessons learned. So we worry about H5N1. So this is a great job I have, right? Yeah, you worry about H5N1. This is the infectious disease mortality chart of people that have their average age about 43. And what happens with this blip, and we all know what that is, right? It's the 1919 influenza outbreak. Right? And is that going to happen again? Is H5N1 the one? Are we going to roll our dice one more time? It's been 10 and a half years since the introduction of H5N1. the dice continue to roll. Endemic in a number of parts of the world, where we're trying to also, at the same time, increase livestock 2020, increase populations of poultry with ducks, and all of a sudden we have this remarkable mixing that comes together. The lesson learned in H5N1 is, as I tell my colleagues at CDC who are physicians, this is a poultry disease. It's a wild bird disease. Sometimes it's asymptomatic. So, we have low path, we have high path. We worry about seasonal influenza and pandemic. So we spent hundreds of millions or billions of dollars. We've learned quite a bit. But our strategy is to stockpile vaccines and antivirals, neither of which may work. We're going to talk about that tomorrow in the workshop that Dr. Torres and the students are putting together. Where is the integration of strategies? It's the critical continuum, folks. These organisms don't care if they live in people, animals, birds, or reptiles. Right? They're just looking for the opportunity. So the continuum is animal and human health are on this continuum of causality and events, and we have to view them as a continuum, not as separate kinds of entities. And the strategies have to be integrated. You can't do human health planning for H5N1 and neglect what's happening in poultry and wild birds and ducks. Right? It has to be an integrated strategy. That's the key lesson learned. So let's move on to the last kind of phase of our ecosystem. And, we haven't done a particularly good job there. Right? We have changed the landscape of the world. 50% of the landscape has changed for good. So we wake up today with 1.1 billion people lacking access to clean water. Good grief. 2.6 billion lack access to adequate sanitation. Right? So why do we have millions and hundreds of millions of cases of diarrheal problems, especially in children? This is the problem. This, we believe, at CDC, is the decade or the time period of new waterborne zoonoses. And there's pretty good evidence that that's taking place in the United States as well as around the world. And it's partly this congruence, if you will, of populations, where water becomes an essential media, right, where the transfer takes place. So one of the things we look at is that we've had the highest number of cryptosporidia cases in the United States over the last 2 years that we've ever seen. And the interesting thing about crypto is that it is now becoming resistant to chlorine. And these cases aren't in drinking water. They're in recreation water. So any of you go to these water parks and slides and don't do it. You can imagine. So 95% of these cases of crypto are actually in recreation water, and they're resistant to chlorine. So what happens in the world of vector-borne? So the perfect microbial storm. The middle of New York City, 1999. The right virus with a pristine population, competent vectors, and boom, West Nile. Right? And people thought, that'll go away. Well, as of today, we estimate there's been 1.5 million cases, human cases of West Nile. Changed the landscape of human medicine and veterinary medicine. This is a look at all the counties in the United States that have incidents of neuroinvasive West Nile. So a small percentage of all West Nile cases, 5 to 6%, will actually have people with permanent neural problems because of West Nile. So this becomes a good surrogate to take a look at what's happening in this disease. So you can see it's come throughout the United States. And if I would show you a map of last year, you would see there's more cases of West Nile in Canada than in the United States. And people thought, that can't go up there. It's mosquito-borne. It's too cold. Well, not so. So it is changing our understanding of vector-borne diseases. This is the global distribution of dengue virus. It is a global epidemic of proportions that we've hardly ever seen. Right? 4 serotypes moving around the world in ways we've not seen. Somewhere between 2 and 3 billion people will be exposed to dengue. Think of that. And this is the occurrence of dengue, number of cases over time, and look at that increase, approaching 1 million cases a year. I was down in St. Kitts 2 weeks ago to give a couple lectures, get some more warm weather, right? And at the school I was at, 20% of the students and faculty were infected with dengue over the last 6 months. So I went outside and saw 4 of these big boats, right, with people moving back and forth between the islands and having a great time, but also, I think, transferring diseases. So if you've never heard of chikungunya, anybody heard of chikungunya? Ah, yeah. Well, that's the Cornell people are bright. I forgot. You have a really good spokesman. Chikungunya is not a chicken disease, right? It's an African term that means bent over, and that really describes what it's like to get this disease. Very nasty kind of arthritic joint problems in chikungunya. This is the global distribution of chikungunya virus in 2008. Kind of started as we've seen it in Africa. It broke out, went into the Indian Ocean. Almost 2 million new cases in India. Very, very high titers of this virus, mosquito-borne, right? And if I could show you that picture again of those 24 hours of what's happening, right? This is the perfect microbial storm getting ready to happen. And I cannot, for the life of me, understand why it wouldn't happen here. So chikungunya, get ready. So we're going to be doing more modeling, anticipation, but I think chikungunya is on its way. You heard it here first. So ecotones. Ecotones is a new science. It came in my era. Ecotones were a singing group in Cleveland during songs. Ecotone now is a science, and it's the science where the edge of transition. It's a zone, the edge of transition between 2 adjacent ecosystems that are coming together. Some of them are natural, some of them are man-made, right? But these are kind of the hot spots of the world where these ecosystems come together. Lyme disease is a great example of an ecotone. So in Connecticut, right, 100 years ago, took all the trees out for agriculture, right? Found out that Iowa was a better place for agriculture, started putting the trees back in. When the trees came back in for those beautiful little settings, increase in deer population, increase in mice population, increase in Ixodes ticks, and we will anticipate 30,000 new cases of Lyme disease just this next year. And the fastest growing zoonosis in Europe. Ecosystems coming together, man-made in this case, and changing in very dramatic ways. This is one of, I think, of really interest. This is called Route 3. And it is a road that's just now being completed where you can actually drive throughout Southeast Asia. You can go from Beijing to Singapore. And you can go through about 1,000 villages along the way. And I will guarantee you that this is a man-made ecotone that will challenge new transboundary diseases, communicable diseases, environmental degradation, illegal immigration and migration issues because of this ecotone coming together. Global warming is a different lecture. It is a remarkable phenomenon in itself. Climate change impacting on infectious disease from vector-borne, waterborne, agriculture production, built environments, ecologies, and landscape use. So it's going to be a real impact, we believe, especially in vector-borne infectious diseases. So the people in Europe are now blessed with a disease called blue tongue. We have in the United States, we've always had it, that we've been held hostage actually by the Europeans for trade problems. They had an introduction, and we know why now with this amazing movement. And it may very well be that this is passed through small biting midges that you know, how would it get up in as far as Sweden? So we think that there's some climatic change that will support these vectors. So, but the entry was actually through, I think, trade issues. So that's how rapidly that can take effect. We're bringing in ecologists, National Science Foundation, to understand our ecological settings. It's part of moving upstream. They have a great project called the National Ecological Observatory Network, where they actually are measuring and looking at climate change, land use, with looking at the geosphere, hydrosphere, and atmosphere. And they now are working with us in infectious diseases to start doing measurements in the ecosystem. And they do this 24/7. in very remarkable ways to understand the natural history of these pathogens, how they live outside of host, how they're transmitted, if you will. And having them at the table is really remarkable. So as we end this part, I've always liked this slide. It's called the scream, right? So what can we do? So I hope you're convinced that there's some challenges. If there's not, well, see me after this lecture. The foresight analysis would suggest that emerging infectious diseases are the new normal. Somebody told me the only normal we have now are dials on washers and dryers. And infectious diseases, the world, are not normal. So expect 3 to 4 new emerging diseases every year. And looking at, by the year 2015, somewhere between 8 and 34 new emerging infectious diseases, where the most of them will be RNA viruses, mostly zoonotic, and the proximity to animal populations is the key risk factor. So not only is that today, but that goes into the future. So we live in a world of triple threat. Triple threat where animal health, human health, and environmental health are converged together, and our work in each of these domains will actually help the other two. And until we address these underlying factors that lead to emergence and reemergence, we're going to continue to address emerging infectious diseases one at a time. We're going to go back and relearn old lessons constantly. So it's time to think about a new way of refocusing our efforts, a new way to shift to a more holistic view of health and interactions rather than just looking at humans and microbes, and look at the interplay of animals and our environment as we move forward. So this is just a little cartoon to kind of emphasize that. Emerging zoonoses, right? These are the number of cases. This is time. This is 0 when you see that first case in animals. Goes through a typical epidemiology curve with animal amplification, moving over as it moves into humans with amplification and moves out. So what are we trying to do? So the new paradigm is shifting left. And that shifting left is to start to find out what is happening here. Can we forecast? Can we be better prepared? Can we do early detection so that we could, in Rift Valley, go out and vaccinate animals before we actually see the amplification take place? And then the epi curves are dampened, the human cases are reduced dramatically, and control opportunities and rapid responses are put in place. So that's the future. That's where we're headed. It's going to take a great new research portfolio. It's going to take working together. And health is now an outcome shaped by a wide range of socioeconomic, natural, built environments, political environments that form a complex and ever-changing dynamic. And it's because of this very broad perspective and definition of health that public health teams themselves also have to reflect this reality. And that's what we're seeing. People around this campus with all kinds of disciplines and expertise can pull together and make huge impact on One Health. So it is One Health. One Health is the collaborative effort of multiple disciplines working locally, nationally, and globally to attain optimal health of humans, animals, and our environment. And when we impact one of those domains, we positively impact the other ones. So what a wonderful cause and opportunities for us. So these are the last couple slides. So what are we going to do about this? Right? This is a consensus of recommendations from the National Academies of Science and of a lot of other people that are looking together about One Health. We have to improve the infrastructures not just of public health, but of animal health. And we have to make a special emphasis in developing countries. We have to integrate surveillance strategies and diagnostics. We can do that. But we can't have, it's the continuum, we can't have two separate worlds doing this separately. We have to increase investments in research and development. Always a good recommendation for a university site. But true, this has a huge portfolio of research because of how little we understand. To focus on prevention and not just reaction. To build a new infectious disease workforce. Great opportunities for the medical school in this campus and the veterinary school and the graduate program. We need people in these areas. You have to be skillful, and this university can play a wonderful role in doing that. Improving disease reporting with appropriate incentives in place, designing global strategies and interventions. We need to work overseas. We need to have a new public health, world health, global health diplomacy, where we're going to work overseas, help other countries, at the same time be able to benefit from that surveillance information and preparedness for our own country. Design global strategies and interventions. We have to create zoonotic and emerging infectious disease centers that are these multidisciplinary teams that come together, and we're actually going to start that. So on the drawing board for CDC, we have major assets in Thailand and Kenya, and on the drawing board, 23 new frameworks for global health platforms worldwide based on what we understand in terms of probability and risks of infection. Wonderful opportunities. Meet critical needs for leadership for these new skills and address this public understanding and appreciation. So my look at Cornell from the web would suggest that you have remarkable assets here. And I could take every one of these colleges and programs, right, and tell you how important it is, the role you will play in One Health. Certainly it's obvious in veterinary medicine and human health. You now know in business management, at CDC we have a business roundtable. The business roundtable is to bring CEOs of businesses in and help them design strategies and implement public health strategies to move forward. Law, this is the time for agriculture to start coming together with public health and be advocates and bridge health and agriculture, food and agriculture in ways that we've not seen before. And all of these other institutes, I think on this campus, could be created a One Health Cornell campus to come together and address some of the most critical problems and challenges that we see worldwide. So what's the other real ingredient that we need? We need leaders like this. We need people that can see around corners. We need people that will push us to do things that we wouldn't do on our own. We need this remarkable leadership to take us forward. And there's nobody that did it better or does it better than Dr. George Poppensieck. And what he taught me, in addition to the importance of that leadership, was that good leaders need a foundation of integrity, of ethics, and good professionalism. And he's epitomized that. And so it's a real pleasure for me to be here and talk to you, and especially to dedicate this to one of my mentors and heroes, Dr. Poppensieck. So thank you all very much.
We will be able to entertain some questions, so fire.
I just had a question about some of the charts that showed changes in incidence or number of outbreaks with data from the 1940s or 1955 in the case of dengue. I was just wondering how you separated out survey bias and things like that.
Well, I don't, I wouldn't think that they're 100% accurate. I mean, these are probably old sero surveys that were done. I mean, we can go to CDC, and we have serum banks that go 50 years back. So there's some accuracy to that. But I think rather than look at the exact potential bias, if you just look at the trends, and especially over the last 10 years, I think those are pretty accurate. So I think your point's well taken, but if you look at the trends of what's happening, I think it's pretty remarkable. Thank you. Other questions? Yes?
What do you think the government's response has been to sort of increase positions for veterinarians in these areas? Because clearly there's a need, right? How much are veterinarians really starting to be integrated into these positions, and how much money is sort of being put aside to foster more creation of positions?
So the question is, what is veterinary medicine now starting to be appreciated in this area? So we have 90 veterinarians at CDC, right? And they work in HIV/AIDS, they work in chronic health, they work in surveillance systems, they work in global health, as well as in the center that I direct in these zoonoses. The skill set, the knowledge are remarkable. Their ability then to be part of these teams are really what we need right now. So there are going to be new opportunities. We just met with USAID, who are now looking at putting a fairly major bolus of money in and saying we have to consider H5N1 right? We have to protect our gains, but we now have to look at this broad area of zoonoses. We've been too narrow in our focus, and they're now going to make major investments in, I think, emerging zoonoses, in R&D center concepts worldwide. The World Bank now is starting to invest. Right? And so I think what we need then is to get university settings to help drive that skill set of students to be able to come back as young professionals to work in these areas. So I'm very optimistic that will happen. Now, money in government right now, well, we're going to create jobs, right? So I think I'm just very optimistic about what's going to happen and our ability to do that. For those of you in veterinary medicine, this is your time. This is our time. And we will never see another opportunity like this in the next 2 or 3 decades. You have remarkable possibilities ahead of you that no other generation have seen. Questions? You hungry? Just watch what you eat tonight. You'll know what to eat. Yes, I'm sorry.
Near the end of your presentation, you had a consensus of recommendations, and I was wondering what you thought the current economic problems that we have right now, how is that affecting our ability to prevent zoonotic diseases, and how is it affecting the CDC?
So the question is, with this kind of nasty financial situation and reductions in budgets and government agencies such as CDC, can we really kind of ramp up based on those kinds of recommendations? And I think the whole thing is going to be slowed up a little bit, right? And I think we're still going to be paying attention to these things. We're going to get reductions in budgets like Cornell will and everybody else, but you got to keep your eye on the ball. And what's most important for us? And I think these new emerging infections are. And you just have to look at the charts that the economists do in terms of the impact of these diseases and look at, what's the return on investment to prepare for these kinds of problems. So I think it'll be pushed back a little bit, but NIH is still going to get maybe not as much money, but they're still going to get significant amounts of money. CDC will. I think we're just going to have to be smarter in terms of how we're going to spend this. I really worry most about state public health and animal health that have really cut over the years and really have, I think are losing jobs in food safety and some of the security things, and that really needs to be built back. And I hope part of the stimulus package, we're actually planning at CDC for $3 to $4 billion to come in and go out and create jobs in public health to make sure that we protect those gains.
The white elephant in this whole discussion that you didn't mention really was population control, global population control. If you don't stop the increase in the population, the disease control will be next to impossible because we need more and more areas for food production, which will then increase more and more interaction with the environment and new diseases to come up. How can we integrate population control in this whole issue?
So he got a $64 million question. I just work on these microbes over here. It's a huge socioeconomic issue. So look what China's doing. They're actually trying to have one child per family. I don't know how to do that. I'll just be frank with you. It's a huge issue, and I don't have the wisdom or the knowledge. But you've put your finger on a problem. As long as those populations increase, and the need for those food sources, why this acceleration of emerging diseases will increase. So,
actually, often discussion in the course down campus. And I talked about this issue, and the challenge came from a young woman who said, what do you do about this? And my answer was, we need to educate women to take care of their own reproductive rights. I think if we can convince that as part of the whole package, then we may have a fighting chance to slow it down. We will not stop the increase, but slow it down. So that would be my answer to education of women to take reproductive rights in their own hands.
Yeah, I think it goes without saying. I think we ought to educate some men too. Very good point. Thank you very much. Tom and I had a good discussion today about poultry. It was really good. So,
Lonnie, I wonder if you could say a couple words about the extent to which what you presented is getting through and influencing the NIH in terms of harnessing the capacity of the institutions in this country and providing that competitive source of funding that would be able to address some of this.
Yeah. So the question is people like NIH, that very strong, great kind of research component that has been part of the engine that's been so important to us. I see a glimmer of hope. Okay. And have seen panels put together on zoonoses and have actually heard conversations about moving in that direction. I haven't seen a lot of funds moving in that way yet. I think that will be part of a sea change that's going to be needed in One Health. Now, I've heard Dr. Fauci actually talk about One Health and some of the other institutes. So I think it hasn't caught on completely. It has at CDC. It has in the public health community. It has on, I think, public health schools, just starting in veterinary and medical schools. So give us a little more time. But I think there are going to be some major drivers in place to do it. But NIH is going to be really critical, and it's not going to be easy to kind of jump that barrier. Great question. To one more?
Well, so do you see any danger in doing a vertical approach to emphasizing on one disease like avian influenza, just as AIDS, TB, malaria have a bigger generation of funds by focusing on those three diseases? Isn't it diverting funds away from general public health infrastructure? How do you compensate for that by focusing?
Yeah, I mean, that's a great point. And so, we get funds based on emergencies. So we got a huge impact or increase of funds when West Nile hit. We can't hardly find any funds in West Nile now. But, it's an endemic problem. So, I think our system is kind of based on our emergency response. So Congress tries to help and do the right thing, so they put money in, but they're based on individual diseases more and more, as opposed to looking at infrastructure development and tackling this as a continuum of events. So I showed one slide where I said, we just can't kind of be rediscovering these problems time after time after time. And it's time to take lessons learned and ratchet up to the next level. And for whatever diseases we have today and into the future, I think we have to do a much better job than just to look at one disease at a time. Because I'm not sure that all of our millions, hundreds of millions of dollars in H5N1 have been wisely spent. So if we're going to make that kind of investment, why don't we make that kind of investment then that impacts all of public health as opposed to single disease? So I agree with you.
Final question here. Most of the talk tonight has been on, or questions at least, based on a lot of the domestic issues here in the United States, but we said a lot of the problems are going to be internationally, and especially in developing countries. So, I mean, do we know what these developing countries are being pushed to do or doing for themselves to address the upcoming issues?
So the question is that the point was made that a lot of our potential problems are coming from developing countries. What is their capacity? What is their expenditure? It's kind of a mixed bag. I think some of them are just so poor that they can't make that investment. I certainly think this global health diplomacy for the United States to move into the developing world with a building of capacity in these areas is the right thing to do. And I think that's going to happen more and more. It helps those countries. And I'm not talking about creating CDCs all over the world, which is a mistake. I'm talking about going and understanding their problems and their cultures, doing the training, making key investments to help people get on their feet, do what we need to do. And when we do that, we also end up helping ourselves. So I think it's a win-win. So it's kind of a mixed bag, and that's being done. But I see new investments. When I see the World Bank coming out and making investments in animal agriculture, because they think that also is an investment in public health, I see the economists are getting it, and it's good to see. So, good question. Thank you.